Started.
Hello, I am Dr. Bishar. I am a doctor of this clinic. May I confirm your name and age, please?
This Mr. Adam, 56-year-old.
Okay, nice to meet you, Mr. Adam. I
Nice to meet
came
you.
to know that, thank you. I came to know that you have knee pain. Is it right?
Yes,
Okay. I'm going to discuss about your condition and try to find out what is happening with you. And all the information during our discussion will remain confidential. So is that okay for you?
I'm fine.
Okay, so can you please tell me in your own words what is happening with you?
Actually, doctor, I'm suffering of this knee pain for almost like 3 months. But last week, the pain get increasing, and I feel the knee increasing also in size.
Sorry to hear that. And can you please tell me that who is knee? Both or
It
only?
is the right knee.
Okay, and it is not on the left knee.
Sorry again,
It is not on the left knee.
left knee.
Is it present on the
It's
left
right,
side?
only in the right.
Okay, and you said it started 3 months ago,
Yes,
and it has increased recently.
yes.
And can you tell me how do you feel the pain, or what is the feeling of your pain?
It is like pressure in my knee.
Okay, and does this pain go anywhere?
No, it stay only in the knee.
Okay, and along with pain, have you noticed any swelling?
Yes, there is last week I have swelling more.
Any redness?
No, I don't feel there is like redness.
And any hot skin over the area?
Let me check. Maybe it's a little bit more hot.
And do you feel problem with walking with this pain?
Yeah, of course. I have very limited walking now. I'm not able to walk properly, and it is really problem for me. So please help me.
Yeah, I'll try my best to help you. And can you tell me that when do you feel the pain more? In the daytime or nighttime?
It is at the end of the day more.
That is end of the day.
Yeah, always there. The pain always there. So you said which more morning or evening? It's evening.
Okay. And do you feel any stiffness in the morning?
No.
Okay. And for the last week, is it present all the time?
Yes, almost all the time.
Okay. And did you got any injury to this area before the onset of this pain?
No.
And is it the first time you're having this pain?
As I told you, it is 3 months, almost three
Yes.
months.
For 3 months, and it didn't happen before.
Before no.
Okay. And can you tell me that if yeah, as you have noticed the swelling, is it hard or soft?
No, it's hard.
Okay. And do you feel pain when you touch this area?
A little bit. Yeah.
Have you noticed anything that ease your pain?
I take some paracetamol. It's improve actually.
And anything make your pain worse? One thing you said that walking.
Yeah, when I walk, the pain much increases. I'm not even able to move much.
Okay, I can understand. And can you please tell me that how do you score your pain? Where 1 is the least severe pain and 10 is the highest severe pain?
Maybe 4 to 5.
Okay, I'm sorry for that. And can you tell me that how much is it is affecting your daily life?
Really, doctor, it's affecting. I cannot go to shop. I cannot do my life properly.
Yeah, I try my level best to help you with this. I'm going to ask you a few other questions. That do you have any headache?
No,
Any raised temperature?
no,
Any night sweats?
No.
Okay. Have you noticed any changes in your eyes?
No.
Any redness?
No.
Do you have any rash anywhere in your body?
No.
And how about your appetite?
It's fine.
Have you noticed any changes in your weight?
Sorry again.
Have you noticed any changes in your weight?
Changes in the weight. I'm as usual. I'm overweight a little bit.
Okay. And have you noticed any changes in the weather preferences, like any hot weather or cold weather preferences?
No.
Any shortness of breath?
Not really.
Any cough?
No cough. No.
Any racing or pacing of your heart?
No.
And have you noticed any lumps or bumps anywhere in your body?
No.
How about your bowel habit?
It's fine.
Have you had any diarrhea recently?
No.
How about your water work?
It's fine, doctor.
Okay. And except this knee pain, do you have any pain in your hands or any other joints?
For the time being, no. But in the past, I have severe pain in my toe.
Okay. And for that, did you take any medical attention?
I take paracetamol and some other analgesia, and it resolved a little bit. I didn't visit a doctor.
Okay. And where was that pain? And when did that happen?
Maybe 1 year ago. It is in my big toe in the left foot.
Okay. And did it happen once only, or this type of event happened before?
It's once.
Okay. And have you noticed any changes in your skin?
No.
Any whitish rash or whitish discharge anywhere in your body?
No.
Okay. And may I know that do you have any past medical condition?
Yes, doctor. I have hypertension, increased blood pressure, and diabetes.
Okay. And are they under control?
I'm visiting my doctor regularly, and he said it's fine.
Okay. And do you visit your eye doctor or kidney doctor regularly?
Yes,
And is there any problem?
no problem so far.
Okay. And may I know that what medications you are taking?
I'm taking for my sugar sitagliptin and metformin, and for my hypertension, I'm taking uh, lisinopril and thiazide.
Okay. And for how long are you taking this medication?
It's almost 4 or 5 years.
Any recent changes in the dose?
No,
Okay. Have you ever felt any abnormal or side effects due to this medication?
not really.
Okay. And may I know that do you have any allergy to any medication?
No,
Do you have any, do you take any over-the-counter medication, any herbal products?
not really.
Okay. And may I know that any of your family member have this type of condition?
Uh, my mother had one day a fracture of her pelvis.
I'm sorry to hear that. And any other bone problem in your family or any other disease that runs in your family?
My father have colon cancer.
I'm extremely sorry to hear that. And, at this point, may I ask you a few personal questions?
You are welcome.
Okay. Do you smoke cigarette?
Yes,
And how many sticks for how long?
maybe 15 sticks for 8 years.
Yeah. Actually, this smoking is injurious to health, and I think that it also maybe related to your condition. So I would like to recommend you a stop smoking. And if you need help, I can refer you to the smoking cessation clinic. Will it be okay for you?
Thank you.
And may I know that do you drink alcohol?
Yes.
And may I know that do you know the social limit?
Doctor, I know the social limit, but recently I increased my consumption of alcohol.
And again, that alcohol consumption is likely to be related to your condition. So I would like to recommend you to moderate your consumption. And if you need help, I can refer you to this alcohol cessation clinic.
Okay, fine.
And may I know that what do you do for a living?
I am retired.
And do you think that you need any social support or any economical support from us?
No, thank you. I'm financially supported. I'm fine.
Okay, happy to hear that. And may I know that do you drive?
Yes.
And I can understand that this condition is affecting your driving. So I would like to recommend you stop driving until we are sure that what is happening with you.
Okay, fine.
And at this point, do you want to add anything or do you have any question?
Uh, uh, Doctor, is there any infection in my knee or what?
And before I give you the answer, is it okay if I examine your now?
Okay.
Okay. First, I will need to examine the pulse,
It is like 85 regular.
and then I would like to measure his blood pressure,
It is 150 over 85.
and then I would like to see the eyes for any redness and
No
tenderness.
redness.
Okay, and at this point, I would like to see the knee,
Yes.
and if there is any swelling,
What do you want to see in the knee? There is knee swelling.
redness.
No change in the color of the skin.
I would like to feel the temperature over the area.
Yes. There is some tenderness.
Okay, and temperature over the area.
I didn't get you. Temperature.
Yes.
Temperature, you mean? Yeah. Yeah, it is a little bit
Okay.
temperature.
Now
Okay.
I'd like to see the passive movement of the knee. If this brings any pain by moving in extension and
I,
flexion of
can,
the knee.
I can move the knee, but with some limitation because of pain.
Okay. And, I can understand that it is painful for you, but can you show me how you walk?
Uh, I use a stick. I walk with a stick with some tenderness and difficulty.
Okay. And, at this point, as I have examined you, I also need to do some other examination, like looking into your eyes and also examine your water. And as I have taken your history and examined you, it seems likely to be a condition called gout, as you have a history of previous great toe pain 1 year back. For this, I am suspecting that it is likely to be related to this condition. Most likely that this time it has affected your knee. But the possibility of infection or bug infection into your right knee cannot be ruled out. So for this, I would like to recommend you to be admitted, and in the meantime, we will take some fluid from your knees, and we will examine that if there is any bugs or if there is any certain chemicals. And on that basis, we will be able to give you the best management. And at the same time, as I have found your blood pressure is high, so, and also you are taking thiazide diuretics, thiazide medication, that is also a risk factor for your we are suspecting that gout disease, that is. So I would like to review this medication. Do you get
Which medication?
thiazide diuretics? I will I will contact about this with the heart doctor, and they will be able to guide you at this point.
Okay.
Do you have any question?
Not really.
Okay. Then if at this time I will also referring you to the smoking cessation clinic, alcohol cessation clinic, and I would also recommend you stop driving. And we are going to admit you with this pain, and we are going to arrange that treatment as soon as possible.
Okay, thank you.
Okay, thank you.
It is 16 minutes. Anything you want to add? Do you want to add anything else?
Okay, just one thing I could ask, but this is very personal question. Will it be okay?
Okay.
Do you take any medication through your blood channel?
No.
And again, a very personal question, but it is important to know that. May I know that whom do you live with?
I'm living with my wife.
And may I know that do you have any history of casual relationship?
No.
Okay, I'm sorry to ask that. And do you have any noticed any discharge or anything, any ulcer or anything comes out through your male part?
No.
Okay, that's good.
Okay, thank you, Dr. Manuel.
Thank you.
Okay. Do you want to add anything?
No, at this point I cannot remember much.
Uh, can I comment in the
Okay,
case, or I will ask first?
okay, you can comment.
Well, in your history scheme, what is your scheme for history?
Okay, for history of knee pain, I first asked about pain by site, onset, character of this pain, radiation associated symptoms, timing, elevating and relieving factors, then severity. After that, I went for any systemic symptoms, and then I went for the past medical condition, then drug history, then family history, then personal history.
For the main complaint, you go with Odibara,
For the pain, I go for the Socrates.
secret. Mm, okay. Because there is an important question to ask when you study the complaint of joint pain. You ask it late, but I don't know. I prefer to ask it early. If there is any injury or fall, it come late. You ask, but it was late. And then the following question, you will ask if there is stiffness too. Then you will ask if the pain increased by movement or by rest. Here we'll differentiate between the inflammatory and mechanical. And to rule out injury fall, it's very important. And after you complete the same joint, you ask if there is any other joint in any part of the body. Then you ask all the question related to the system involved. You are now in the musculoskeletal. You ask all question about musculoskeletal, involving the other joint, uh, stiffness, the skin rash, rash to sun exposure. Are you with me?
Yes, yes, I can hear you.
Mm. Is it fine?
Yeah.
Mm. Okay. Then when you examine patient, did you examine the hand?
I actually forgot, but I thought that I'd like to examine that. I should have
What
checked
is
that.
your differential?
For this gentleman, my differential is this is most likely a case of gout arthritis, and also my differentials include there can be a cause of septic arthritis, then can be a monoarticular presentation of rheumatoid arthritis, though unlikely, and for large niche joint
Before rheumatoid arthritis, it's inflammatory rheumatoid arthritis. Before that, it comes
pseudo
for
gout,
mechanical
and also
pseudogout
pseudo gout and osteoarthritis.
osteoarthritis. Did you ask any question about osteoarthritis?
I don't know if there is anything uh, uh, special related to the osteoarthritis.
You, you want to ask in the history about friction in the joint, if there is any sound when you move your joint, and in the examination also to check if there is any sound or any sign of osteoarthritis. And in the hand, if you examine the hand, I will tell you that there is a hybrid Bouchard nodule.
Okay.
And the history of osteoarthritis, in the history, you ask about back pain, neck pain, history of osteoarthritis in the past history. Okay.
Okay.
So, what are you going to do for this mission?
Okay. For this gentleman, I first I need to rule out this is not a case of in uh, this is not a case of infection. Then for that, I will like to admit this patient, and I will run some blood test, including complete blood count to see white blood cell count level and inflammatory markers like ESR and CRP, then some other routine test like liver function test, renal function test, urine for routine examination, and random blood sugar level. And after that, I will examine for the joint. I will aspirate the joint and send the fluid for cytology and for microbiology. And also, I
What do you expect in
pathology.
the
For
biopsy?
the cytology, if this is a case of infection, then it is likely to be raised neutrophil count. Then, if it is a case of crystal arthropathy, then there can be a rise of monosodium urate crystals. Then, I will also then there also uh, be gram staining that can
Gramston and culture.
Gramestinian and culture, yes. Gramestinian culture, and then some imaging test like X-ray of the knee.
Okay. Then how you manage?
Yeah, as I am suspecting, this can be a case of infectious condition. I will,
In a view of gout.
yeah, in view of gout, first I will go for the non-steroidal anti-inflammatory medication, and also if the condition is severe, I can go for the intra-articular steroid injection.
Okay, what else?
And for the chronic management, I can start medications like colchicine and
Are you
albumin.
going to manage alone?
I will involve the multidisciplinary team, including a rheumatologist and cardiologist and also endocrinologist, as he has uncontrolled high blood pressure and he is suffering from diabetes.
And physiotherapist,
Yes, physiotherapist and
occupational,
occupational therapist. I forgot to mention that.
and regarding his medication?
Regarding his medication, I will review his medications like thiazide. It is a risk factor, and for that I will involve the cardiologist.
What else?
I cannot remember.
What do you suspect? What is the reason for his gout aside from thiazide and lisinopril cause also, right or no?
There would be some are certain risk factors like alcohol consumption, certain types of food, especially red meat and seafoods.
That's why I'm asking what else.
Yep.
So you'll advise patient to moderate his consumption of alcohol and
And
refer to dietitian.
dietitian is.
If you ask me about, I told you I am retired. If you ask me about the previous occupation, I will tell you I am pottery. Pottery, it is correct spelling, pottery pronunciation.
What does they do?
Meat, selling meat, butchery.
Yes, sir.
Means he consume a lot of meat.
Yeah.
Okay, fine. For maintenance, what is your option for treatment for acute phase?
For acute phase, treatments are like non-steroidal inflammatory medications, then colchicine, then intra-articular steroids. And for maintenance, some medications that is urate lowering agents like allopurinol. And along with allopurinol, there might be continuation of some non-steroidal inflammatory drugs.
You can give in the acute phase allopurinol.
I can start the medication at discharge along with the non-steroidal inflammatory medication.
What is the indication of allopurinol in the gouty?
Okay, in allopurinol indications like recurrent gouty arthritis, then raised serum urate level
How often?
more than once in a year. I cannot
To
remember.
attack per year, right? If more than 2 attack per year, then
Okay, more than
that's
two
what
attack a year.
And if there is renal impairment,
Yeah,
and if there is gouty tophi.
Okay, renal impairment, gouty to 5, then I should start allopurinol. Okay.
In case patient have creatine clearance of 30, what option treatment?
Sorry, I couldn't get you. Can you repeat again?
Creatine clearance, you do his investigation, creatine clearance was 30.
Okay, for that, I would go for the intra-articular steroid at acute phase.
Even systematic you can give.
Colchicine.
Colchicine.
Okay,
colchicine.
Yes.
Colchicine, there is also limitation the creatine clearance, right?
Okay, then I don't know.
Give intraarticular steroid and you can give systematic. Even colchicine, there is limitation. I think below 40, I will review it. Below 40, you can give, I think. I don't remember. I will review it and I will reply. You want to add anything?
No, I missed. I thought I think they should have been asked because they were important regarding gout.
Thank you for nice performance.
Okay, may I add something now?
Yes, yes.
Well, just adding something that when you are adding allopurinol or fevixostat, I think there should be some backup treatment from NSAID or colchicine for the first 6 months. Okay, otherwise it can be flare up again. Okay, when we start allopurinol or fevixostat, that should be the previous treatment. What was going on? Okay, Yeah, that should be maintained for 6 months to at least 6 months, I guess. Okay.
Can you repeat
Another.
again? Because I couldn't get you. You were too fast.
Hello.
You were too fast. Can you please repeat again?
Yeah. For prophylaxis, scout prophylaxis, as Dr. Haitham rightly said, the indication. Okay. Like renal impairments, trophy, recurrent attacks. When you start allopurinol, you should have that backup of previous treatment like NSAID or steroid or colchicine. What you were giving, you should continue with it along with allopurinol for the past 6 months. Okay.
Yes.
Otherwise, there would be a flare up. So whenever you tell about allopurinol or febuxostat starting, you should tell that with the backup of that previous medication. Okay.
Okay.
Okay, that's one thing. Another thing is that the patient had diabetes. Am I right?
Yes.
Okay. Did you ask about repeated blood transfusion?
No.
Okay.
For the C we are suspecting.
Yes. Yes, it's very important. Whenever you find diabetes, you should ask about repeated blood transfusion in this patient because it can be hemochromatosis. Okay. Has he been pale from childhood, or has he been diagnosed with any blood disorder? Has there been repeated blood transfusion? Has he ever experienced any yellowish discoloration? These questions should have been asked. Again, mood disorder, any renal colic like any crampy tummy pain, any polyuria, any changes in his micturition, not only discharge or pain in water work, but also increased water work because hyperparathyroidism, hypothyroidism, and hemochromatosis. At least these three should be excluded. Okay, and yes, I think that's all. I don't remember much, and actually I joined the mid time, so I couldn't get the whole conversation. Okay.
Okay. You have added a lot of things.
Okay. Thank you. What is the plan now?
We should go for the next. We should go for the
Okay.